Back to everybody. I hope you had a good break. I hope you had a good morning. I hope you're stoked to hear some interesting information. First up, we have Ellen Demlow from Vancouver Coastal Health. This is going to be a 30-minute session. It's going to cover the current state of social isolation in Vancouver. Ellen brings her knowledge and research that will introduce you to the benefits of strong social connection, as well as the adverse effects of social isolation on health and well-being. I'm going to send it over to you, Ellen.
Great, thank you. And let me just, share my slides here. We'll put this onto presentation mode. Are you seeing the full slide, or are you seeing the terrible presentation mode version of the slides?
We see the right thing, like a big screen.
You see the big screen, fantastic, because the other one gets a bit distracting. Well, thank you so much for the introduction. I do want to acknowledge that I am joining you here from the traditional territories of the Coast Salish people, specifically the Squamish, Musqueam, and Tsleil-Waututh people here in downtown Vancouver. And I'm grateful to be here, and I hope you can pause and reflect on where you're joining us from and what that means to you. So today we're going to talk about social connection and how it relates to health, and then what we know about kind of our more local scope of social connection and health in the Vancouver area, based on data that we've collected across the region, as well as updated data that we've collected since the pandemic, because we do know that there have been unintentional health consequences of the pandemic, and those effects on social connection are being looked at the health region levels. So first, I just want to talk about social connection in general so that we can kind of be on the same page here. So what I am describing here is that subjective experience of feeling close to and a sense of belonging with others. And there's three ways that we often capture it in social connection research. So there's the concept of social capital. So that's access to support, resources, information due to your relationship with others. We look at social cohesion, so your perception of belonging to the community around you, whether that's your family, your neighborhood, however you define community for yourself. And then social inclusion. And here's where we're looking at more broader, so that full and equal participation in a lot of our social, cultural, and political institutions. There's a lot of benefits to high social connection, a lot of health benefits. So we do find that people that are strongly connected have a 15% increased chance of longevity. And we can actually inverse that. So people that have poor social connection have a 50% increased all-cause mortality. That is as strong an effect on someone's health as smoking 15 cigarettes a day. People that have a strong sense of social connection, they actually have stronger gene expression for immunity. They have lower rates of anxiety and depression. They have higher self-esteem. They have better emotional regulation. And they also benefit from the social connection, creating a positive feedback loop, creating positive associations with the people around them as well. And the risks of social isolation are real, and we've experienced them recently. So this is a slide that was taken from the BC Coroner's report as it related to the heat dome back in last year in 2021. Where we had over 619 heat-related deaths in BC, and more than half of those deaths, we learned from the coroner's report, lived alone, and almost half, 49% of those who died lived in areas experiencing what we're calling social deprivation, which reflects the deprivation of relationships among individuals in the family, workplace, and the community. And we see this across a lot of extreme disaster events, where those that are socially isolated are at much more extreme risk of morbidity and mortality. So a lot of the data that I'm going to share with you today comes from a survey that we conducted at Vancouver Coastal Health called My Health, My Community. So just really brief overview of what this project is. It was a survey for us to help understand the burden and determinants of chronic disease, address current and emerging needs to develop more effective prevention, and allow us to partner with local governments and community organizations to really enhance that health promoting ideas and advocate for healthy public policies. And a key aspect of this survey was looking at concepts of community resiliency and community belonging. So while it has a lot of markers of a classic, what I would consider population health survey, i.e., do you exercise enough? Are you eating enough fruits and vegetables? Those pieces. We did ask about whether or not people feel socially connected and what their sense of community belonging is, how many people in their lives they have to confide in. Because we do view that as a health metric, not just a social metric. I won't go into the methods too much, just let you know that this survey, so the initial data that I'll share is from 2013-14, and then I'll be sharing data later on in the presentation that's very recent, up to 2021, post-pandemic. But just to give you a sense, this was a very successful and broad population health survey that covered, we had about 33,000 responses across the Lower Mainland. And we did this in collaboration with our neighboring health authority, Fraser Health, as well. And we asked two main questions with regards to social connection in this survey. So the primary indicator was, how would you describe your sense of belonging to your local community? And just in a scale of weak to strong. And then we asked about how many people in your network do you have to confide in, tell your problems to, or call when you really needed help. And the primary indicator that we used was 4 more people to confide in as someone who had stronger connection than people that had less than 4. So when we looked overall across the Lower Mainland, we found that about 56% of people indicated that they had a strong sense of community belonging, and about 45% indicated 4 more people to confide in. And what we learned is that this is highly correlated to your sense of both excellent or good general health and excellent or good mental health. So what we're seeing here is essentially, well, a gradient. So as your social connection increases from very weak to very strong, your perception of very good or excellent mental health or general health increases substantially. So we found that 2 points, so people who had a very strong sense of community belonging, they were 2.6 times more likely to report very good or excellent health, and 3.2 times more likely to report very good or excellent mental health. To put this into context, often when we think of an intervention and a health outcome, in public health, we're thrilled when we have like a 10% increase. So this is looking at a 220% increase when we look at the exposure of strong sense of community belonging. And similarly, when we look at number of people to confide in. So if we go to the more extreme end, so people with 7 or more people to confide in were 70% more likely to report very good or excellent general health, and 3.4 times more likely to report very good or excellent mental health. So then we wanted to understand, okay, so who in our population are experiencing a strong sense of community belonging? So we found a few things. So we did look at the correlation between age and social connection, and we did find that as age increased, the greater proportion of respondents to our survey indicated a strong sense of community belonging. And we didn't find as much of an age correlation when we did look at people who have 4 or more people to confide in. And then when we looked at a few other indicators, so we did find that women compared to men were 19% more likely to indicate a strong sense of belonging, and 54 or 1.54 times more likely to have more people to confide in. We didn't find much difference when we looked at income for community belonging, but we did find that number of people to confide in increased among people that had higher incomes compared to those with lower incomes. Interestingly, when we looked at education, which is often considered a social determinant of health, we did find that people with a university degree compared to those with less than a university degree or less than high school degree, they were 22% less likely to report a strong sense of community belonging. And we don't really know why. I mean, perhaps maybe with higher education, there's more mobility. And so you might be in a newer community than people that have been more established over time. But that's just a hypothesis that's not proven. We found that folks that were married or common law compared to single had a 25% increase likelihood of indicating a strong sense of belonging. Households with children, and that's actually been consistent through the pandemic as well, were more likely. And interestingly, there was no difference between new immigrants compared to Canadian-born in their sense of belonging. And again, this is controlled for all kinds of different factors like age, gender, ethnicity, et cetera. And this is looking at the distribution of community belonging across the Lower Mainland. So just in darker blue here is just a higher than average proportion of the population indicating belonging versus the light blue. And I think what jumps out to me here is that you definitely just see some of our more established neighborhoods, maybe perhaps undergoing a little bit less continuous change, that where we are seeing quite a bit of that belonging, because we know that time in neighborhood is a huge indicator, which I'll talk about. So now we'll look at some of the healthy behaviors that are associated with connection. So here we're looking at associations between lifestyle attributes and connection. So across the board here, there's a few kind of individual indicators like physical activity, healthy eating, et cetera. And then we also created what we would call an index or an overall health wellness score that takes into account numerous factors that we know promote health. And so those included things like, well, like physical activity, healthy eating, yeah, just all kinds of different health behaviors in there. And so we did find that people that had a higher wellness score were 1.4 times more likely to report a strong sense of community belonging and 1.45 times more likely to report 4 or more people to confide in. One that jumped out for me from this result too is that people who had less screen time had a significantly higher sense of community belonging. Yeah, just a bunch of different health behaviors that we thought were interesting that are significantly associated here. And when we look at stress, you know, we did find that it had an inverse effect on your sense of belonging. So people who were quite or extremely stressed were half as likely to report a strong sense of belonging and 43% less likely to report 4 or more people to confide in. And you can see on the chart there that as stress increased, the proportion indicating belonging also declined. We also found that people that indicated that they had been diagnosed with a mood or anxiety disorder were about 25% less likely to report both a strong sense of belonging and 4 or more people to confide in. We also looked at built environment characteristics, which has been really influential in how we've engaged with Metro Vancouver and a lot of our municipal partners on basically, you know, how can we create space in our urban settings that facilitate social connectedness. So again, kind of looking at this bubble, there was strong association with connectedness when we looked at different attributes of somebody's neighborhood. So here we were looking at associations between, well, yeah, these attributes. So just like with the wellness score, we created a neighborhood index score. And again, this is a composite score that looked at all kinds of factors, most of which are already listed here individually. So things like, is this a neighborhood that have pathways for cycling, well-maintained sidewalks? You see a lot of people out shopping, you know, attractive natural sites, kind of those neighborhoods that I think a lot of us are generally attracted to in general. We found that those neighborhoods were 2.7 times more likely to report a strong sense of belonging and were 1.67 times more likely to report 4 more people to confide in for people who lived there. And interestingly, you know, some of the factors that really contributed to belonging were things like just seeing people out and about using those spaces. So seeing many people walking and cycling, you know, they were 2.4 times more likely to report a strong sense of belonging. Is your neighborhood attractive? Do you have parks and views and places that you want to be in your neighborhood? People who live there tend to have a strong sense of belonging as well in those areas. Yeah, and so again, this data, you know, we've worked quite closely with our municipal partners on how can we enhance some of these key features to increase belonging. And with commuting, you know, we learned quite a bit here too. So accessible transportation, it connects people and reduces isolation. So people with longer commutes were 20% less likely to report a strong sense of belonging to their community, while people who walk or cycle to work were 18% more likely to report a strong sense of belonging. That could be because to walk or cycle to work, you're kind of working where you live. It could also be because physical activity has an association. Again, like these are associations. We don't necessarily have direct causation with the type of data that we collected, but it's interesting to see these factors. I found that when I biked to work, I really enjoyed my neighborhood quite a bit more. And then when we look at stability and tenure in an area, we do see quite a strong effect as well. So people who have lived in their neighborhood for 13 or more years are 2.5 times more likely to report a strong sense of community belonging. And that was irrespective of whether people rented or owned their home. Really, there's a push then, a sense that we got when we presented this information to the cities of, let's try to keep people where they want to be, because we know that that has a substantial effect on their health through connectedness and other means here. And even though we did have a bit of a gradient effect where it didn't matter if you rented or owned your home, you can see in the graph to your right that there is an additional benefit to home ownership when it comes to belonging in your community. So then we can talk about how the COVID-19 pandemic has affected social connectedness. And these findings are coming from a different survey, the My Health, My Community, but one in which My Health, My Community had a huge effect on. And that was the BC COVID-19 Speak survey, which some of you may have participated in because this was broadly advertised during both 2020 when the first iteration was launched, and then again in 2021. And so here, anybody who was 18 years or older that lived in BC was welcome to take the survey. A lot of the questions across the survey were validated. Many came from My Health, My Community. I had a huge influence on this survey as well, given my background on My Health, My Community. And it was wildly successful. So the first round of Speak, we had almost 400,000 responses across BC. That's about 10% of the population. So that survey was likely at least the most well-engaged population health survey that's ever been conducted in Canada. And the second round of that survey in 2021 had almost 190,000 participants, or 1 in 25 British Columbians. We are gearing up for round 3, so hopefully stay tuned about when that's coming as well. And we found a bit here when it came to community belonging. So we asked the same question about whether or not people felt they had a strong sense of belonging. And this is data for Vancouver. So we're looking here across time. So the My Health, My Community result for Vancouver is on your left there at 54% of respondents indicated a strong sense of belonging. For Speak Round 1 by 2020, that proportion of residents had increased to 59%. And then 1 year into that pandemic, so 1 year into all of the lifestyle changes that we all endured, that declined down to 42% in our region, that indicated a strong sense of belonging to their community. This is data that we're looking at very, very closely at Vancouver Coastal Health. I'll show you some more data that indicates a bit of who's more affected by some of the mental health concerns that we have coming out of the pandemic. And we know that community belonging is a huge part of this, needing to find health interventions to increase that, which I hope is something that you're inspired to do based on the topics of this conference. So one of the key populations of focus that we have here at Vancouver Coastal Health when it comes to recovery from the pandemic is looking at mental health among young adults. And again, kind of drawing mental health connections with feelings of isolation. So we did find that respondents 18 to 29-year-olds had higher proportions across all of these indicators. So for example, 67% of young people in our region indicated that their mental health was worsening during the pandemic, compared to 57% in BC overall. When we look at feeling lonely always, 23% of young people indicated such, compared to 12% in Vancouver and VCH. Sorry, VCH is our health region, so that includes Vancouver and Richmond and the North Shore. Only 16% were hopeful for the future among young people, compared to upwards of 26% for BC overall. 36% of young people indicated that they were very stressed, compared to, again, 25% in BC overall. Financial stress current, again, a much higher proportion of young people affected. When we look at food insecurity, young people were more affected during the pandemic. And there was also feelings of discrimination due to age during the pandemic for young people as well. All factors that we know affect connectedness, and they're all factors that we know contribute to a mental health crisis that we're very concerned about in our young people here. Another group that we've been very focused on in public health has been the effects of the pandemic on children. Now, I do want to caution that this data is asked of the caregivers of those children. We didn't solicit children responses directly, but we are still seeing quite an effect here. So in orange is the round 2 responses, so 1 year into the pandemic, and blue is the round 1 responses. So we can kind of look a bit over time. So parents and caregivers who indicated that their child's stress had increased was 81% 1 year into the pandemic compared to 57% at the beginning of the pandemic. When we looked at connection with friends, 88% of parents said those connections had declined 1 year into the pandemic, compared to still quite high at 76% in the spring of the beginning of the pandemic. And when we look at just more screen time, and we heard earlier that screen time is highly associated with poor social connection. We're looking at screen time in our children. 92% of caregivers indicated their kids are using more. We had an expanded question set for children for round 2. And so the data on your right is just from round 2. But just overall, 61% of caregivers saying their child's well-being had worsened, 61% saying their children are learning less. They're having less extracurricular activities, and their physical activity had lessened at 75% of responses. Again, this is data that the health authorities are taking very seriously when we think about post-pandemic recovery. So a couple key takeaways that I'd like you to have from our local data and where we're focusing on from a health perspective. So we do know that social connection is a very strong indicator of general and mental health. We know that people who undergo healthy behaviors are more likely to report strong social connection. People with lower levels of connection report higher levels of stress. Neighborhoods with higher resident rated built environment features reported greater social connection. The proportion of Vancouver residents reporting a strong sense of community belonging fell 1 year into the COVID-19 pandemic. And young adults and children are populations of focus for much of our post-pandemic public health recovery. And that is what I have for you today. And I'm looking forward to taking any questions that you might have.
Thank you, Ellen. Do we have any questions? I think you can just feel free to unmute yourself and ask away. I can also look at the chat and share if somebody wants to do it that way.
I'm not sure if you're more in the realm of like doing the studies or also the impact, but I'm curious as to what are like some of the solutions that Vancouver Coastal Health has thought of regarding young adults and mental health post-recovery of COVID.
Yeah, no, that's a great question. So we do have a full population health team that works with a lot of nonprofits across the region. So there's a big push to do a lot of our grant funding for communities or for organizations that are going to directly try to enhance connectedness in the community. I know with Vancouver, City of Vancouver specifically, we work directly with their social justice team. I forget. I know all the key players, but they have their Hey Neighbor initiative and a lot of their social connection groups that we've shared this data with. But a lot of what I do is, do the questionnaires, solicit the data, and then analyze the data, and then present that to the partners to see how people might find ways to intervene.
I think we have a question from the chat. It was about on the research of children, was it a certain age group?
It was just if your children were under 18. We had a few questions specifically for children that were 5 and under as well. A lot of those pertain to childcare access because we we know that a lot of childcare was removed at the beginning of the pandemic, but we do have the ability to stratify by those less than 5 versus those greater than 5. But it was essentially anyone under the age of 18 or caregivers responding on behalf of anyone under the age of 18. And I do see another question here about whether or not the data is publicly available. It is, and I can circulate. There's 3 different dashboards. There's a My Health My Community dashboard where you can look at all of this data down to your neighborhood level across the Lower Mainland, and as well as both rounds of the Speak survey have their own interactive dashboards as well, where you can both look at all the indicators of the survey as well as compare indicators across regions in your city. So for My Health My Community, please feel free to go to myhealthmycommunity.org, where you can find that interactive dashboard. And then for Speak, if you just Google search BC COVID Speak, you'll be able to find on the BC CDC website access to those dashboards as well.
Can I just verbally ask a question?
Yeah, of course.
So there's lots of data there, and can you describe how the data turns into recommendations? Like, what's that process like?
Yeah, well, again, a part of our job, at least part of my job, is to, identify a health topic of concern or a health topic of, just to make aware to our medical health officers. How it turns into recommendations is that then we would do literature review of what effective interventions are in order to, obviously have the greatest impact on those populations. Unfortunately, that's not completely what I do. I do more of the data generation side of it, but we do have our healthy public policy team that would create recommendations for the cities on how to then address this moving forward. And there's also some great resources. I know Charles Montgomery is in Vancouver, and he does a ton of work as it relates to how we can increase social connection and belonging in our areas. So whether or not that's starting, community fairs and events to allow people to feel more integrated into their areas. The Vancouver Hey Neighbor Initiative is online. I encourage you to read about that. It's looking to how can we create more community belonging in a lot of our more urban areas, like high density living environments where we know historically there has been less connection. So yeah, I guess those are 2 resources that I would point you to initially. But yeah, I mean, there's actually just a lot of data on just saying hello to a stranger, like on the bus, and how that can reduce their stress within that moment has an effect. I remember reading that in one of Charles Montgomery's books and immediately started saying hello to certain people on the bus that seemed like they might need a hi. There's little things, but obviously when you're thinking about brands and how some of our private sector can help support this, again, it's just trying to create avenues for connection. So bringing different aspects of your community together. But I would leave it to our policy experts to really provide many of those recommendations.
I have a question.
The question here is, hey neighbor, I think is what you might be asking in the chat there, Tanner.
Thank you.
And I think there's interventions too, just on creating environments that facilitate connectedness. So some of the data that we were able to share about what are features of an urban environment that facilitate connection is key. And I know the city of Vancouver is very interested in how we can create both more urban parks, green spaces, as well as urban, just more open squares and avenues to create space as well and more trees. Thanks, Anita. We need more trees for a lot of reasons. Part of it is also climate resiliency from a health perspective and heat perspective, but absolutely for connections as well. We know that people who think their natural spaces are attractive have a higher sense of connection. So I'm just reading Gerald's here. Yeah, I can definitely provide some links on how people can apply for Vancouver Coastal Health grants. Absolutely, for some of their nonprofits. Yeah, let me make a note, and I'll make sure Amanda has that information afterward.
Okay, we have one more minute if there's one more question before I take the mic from Ellen and present our next host. Any more questions?
Great, thanks
Ellen?
everyone.
Ellen, do we have your slides? There were a few people who asked. I know there will be a recording of this, but a few people asked if we could get the slides. Do you know if we have them already?
I did send them to someone on your team,
Okay.
and Carla.
Okay.
And yes, you're welcome to circulate. We also have our social connection and health report on the myhealthmycommunity.org website as well. So feel free to have a look there. And then, like I said, all of the speak data from the pandemic is all publicly available as well online on the BC CDC website. You can just Google BC COVID Speak. Thanks.
Thank you so much, Ellen. Thank you. I think everybody appreciated that. Lots of great questions. Okay.